Our next panelist is well-recognized and known, Dr. Robert Caperuso. He is a podiatry at Complete Family Food Care. Dr. Caperuso, as a podiatrist, can you describe how poorly controlled diabetes affect your feet?
Dr. Mago, yes. Some of it's already been mentioned, but there's basically three ways that the foot is affected by diabetes. One is the PAD, peripheral arterial disease, or poor circulation. The small vessels below the knee and below the ankle are affected by the diabetes, and you wind up getting lack of circulation, which leads to gangrene. And that's something we see, unfortunately, almost every day in practice. The second way that the foot is affected is by neuropathy. And neuropathy is a lack of sensation in the foot. And the nerves, due to the high glucose, the high sugars, don't function anymore. And so what happens is your foot becomes numb. And it starts out with these tingling, the hormiguea, you feel like there are ants are crawling on your feet, things like that. You may bump your foot and not feel it, or you may start to develop calluses on the bottom of your foot that have black material inside that. And that black material is actually blood because you're walking too much and the foot is not protected. And then that leads to ulcerations. And that's probably one of the things we deal with every day is an ulceration and how we heal that as such. And I don't want to steal any thunder from Dr. Arinaga, so we'll let her talk about that. But, ulcerations is what we're trying to avoid because what happens? Once you have that ulceration, your chance of getting amputation increases tremendously. The majority of lower extremity amputations occur due to not having a non-healing ulceration. And this is one of those things where time doesn't heal all wounds. And so you can't have a wound on your foot, an ulcer on your foot, and say, well, I've only had it for a couple months, it'll go away. The longer it's open, the higher the chance you'll have an amputation. And you want to deal with those ulcerations as fast as possible to try to heal them as quick as possible. And then the other thing that's affected by diabetes is called foot deformities. And what happens is the musculature, the small muscles in the foot, become atrophied. They become wasted away because of the nerve fracturing of the bones due to the lack of sensation in your foot. When that happens, it's usually on the inside of your foot, it breaks down, and you get a big bulta, a big ball of bone sticking out in the bottom of your foot, which causes increased pressure and causes you to form calluses and ulcerations. There are simple things that we can do in the office to help prevent these. One was mentioned as diabetic shoes. If you qualify for diabetic shoes, those diabetic shoes, although I hear it all the time, they're heavy, they look ugly, what have you, can protect your foot. And so it's important that you get them if you qualify to have those. The second thing are we do clinical exams. We feel your pulses. We do one little thing called a Semmes-Weinstein, which is a little monofilament, like a piece of fishing line, that we touch your foot with to see if you have what's called protective sensation. If you step on something, will you feel it? I can show you cases after cases, like most of us can here, of people that step on thorns, that step on glass, that step on little toys in their shoes that they didn't know the grandchild put in their shoe, and now they come in with gangrene or an infected foot because of that. So little clinical exams that we can do each and every day that we do in our office to stratify the patient with diabetes to see where are they. Are they low risk, which means they really have no deformities, they have no poor circulation, they have no neuropathy? We're going to see you once a year. The patient with moderate risk, maybe you have poor circulation, but you have no open areas. We're going to see you every 3 months or so. And then the high-risk patient is a patient who comes in with an ulceration already or a prior amputation where the foot is now deformed, and we have to do something about that too. So PAD, poor circulation, neuropathy, lack of sensation in the foot, ulcerations, and foot deformity are the biggest concerns that we see in a podiatry office.